If you'd never heard of buccal fat until a few weeks ago, you are not alone. But suddenly, its removal has become the hot plastic surgery procedure of 2023. Thanks to the angular cheekbones of celebrities like Bella Hadid and Emily Ratajkowski, everyone wants a more chiseled appearance. And for people with rounder cheeks, no amount of weight loss or makeup will achieve that look. They're just born that way. But why is everyone talking about it now? It's thanks to Twitter, TikTok, Instagram, and funny girl star Lea Michele, who recently posted a very glammed up fish face selfie. But she's not alone. A number of female celebrities have shown off far more sharp-cheeked looks of late, sparking speculation that they've undergone the trendy procedure. Chrissy Teigen is one of the few to actually admit to having it done, and she is loving the results. So, what is buccal fat? How is it removed? What are the risks? What difference does it really make? And who should avoid it at all costs? We asked 3 cosmetic surgeons to talk us through everything you need to know about buccal fat removal. Buccal fat is a pocket of fat that sits deep in the muscles between the cheekbone and the jaw, and it helps to support the cheek structure. Removing it gives the face a more hollow look and thereby enhances the cheekbones. Surgeons describe it as something of a permanent contouring.
So removal of buccal fat surgery is something we've seen over recent years where people can have that portion of fat removed. And it can be done under local anesthesia, so it doesn't require any general anesthesia. It can be done in an office setting. And the other nice thing is it can be done from inside the mouth. So there's no incisions or there's no visible incisions.
Well, it's a permanent effect, and the contour is a long-lasting contour, but as we age, other things change. So as we age, the soft tissue laxity kicks in, the jowling begins. So at some point that needs to be addressed as a separate issue, but the buccal fat removal itself is long-lasting. Buccal fat pad really lives in the 20s, 30s, maybe early 40s population because their skin is still tight and will contour to any kind of fat removal.
Celebrity beauty trends combined with social media posts about buccal fat removal have sparked a lot of speculation about who might have had it done, and it's brought the words buccal fat into the modern lexicon. Chrissy Teigen confirmed last year that she'd had the procedure done, and she showed off a far more contoured face as a result.
I did that Dr. Diamond buccal fat removal thing here, and since I quit drinking, I'm really seeing the results, and I like it.
But many other celebrities are rumored to have had the surgery, prompting a huge uptick in demand for it. Surgeons say many of their clients are referencing Bella Hadid's sculpted face and sharp jawline as an example of how they want to look.
Yes, I have seen a lot more patients inquiring about this procedure. I think it recently gained popularity because there's suspicions that certain celebrities like Bella Hadid underwent the procedure. In addition to Chrissy Teigen, she announced on her social media that she had the procedure, and of course she looks fantastic. So I think with the influence of these celebrities, in addition to the power of social media, to be able to get information out there to a broad audience in a short period of time has led to the popularity of this procedure.
The procedure, according to surgeons, is very straightforward and can be done under local anesthetic in under an hour. But it will cost you in the region of $5,000 to $10,000.
So the videos you've seen is spot on. It looks like it's almost like a little meatball that comes out as one piece, for lack of a better way to describe it. The key is just taking out the excess and shaving off the excess.
Buccal fat pad removal is a very straightforward and easy recovery. I mean, of course, there are exceptions to that, but I think in general, I tell patients if you had this done on a Thursday or Friday, you look pretty reasonable to go back to work by Monday.
The complications that are specific to this procedure are asymmetry, infection, bleeding, injury to nerves that run in close proximity that can cause abnormal movement to the face or sensation changes, as well as injury to a major salivary gland that also runs very close to the buccal fat pad.
So the first thing with buccal fat is not everybody's a candidate. I mean, and the issue or some of the reason why we've seen this tremendous uptick in people seeking this is it's sort of the ultimate selfie face or the kissy face. And so that people love that when they take pictures, but that doesn't necessarily mean that buccal fat's the answer.
So patients that are perfect candidates for buccal fat removal are those with a rounded face or face that has more volume.
With all this conversation about weight loss, Ozempic, for example, massive weight loss or rapid weight loss. You have to be especially careful with buccal fat removal, because if you really are successfully going to lose weight, I don't mean 5 pounds, 6 pounds, that fat can be helpful.
A face that's more rounded or a face that has more volume has a more youthful appearance. And as we age, we lose volume from the face. When you lose fat, you start to have more looseness in the skin or sagging of the skin. So if you already have skin laxity and you undergo this procedure, it will make the skin laxity worse and further accelerate the aging look or the aged look. You can do procedures to add volume back to the face, so that's filler treatment or fat grafting to the face. But just remember that corrective procedures are always more challenging.
I just think it's important to have a realistic expectation of what a buccal fat pad removal is really going to accomplish. And you know, a lot of times online, they'll say, oh, this person had a buccal fat pad removal. And that can be true, but they may have had a couple other things done too.
Though buccal fat removal is the hottest new trend, knowing all the facts and risks about the procedure is the best way to decide if the surgery is really right for you.